Nepal has sent out an SOS call. Prime Minister Palki Sharma has appealed for help through a newspaper write-up. As his country witnesses a surge in Wuhan virus cases, the Prime Minister wrote an opinion piece for a British daily. He said that Nepal is being overwhelmed by COVID and is in need of urgent assistance to combat the deadly second wave. Remember, Oli lost a vote of confidence on Monday. Now, with the government in crisis, the Himalayan Republic is battling a resurgent virus. Our next report tells you how delicate Nepal's situation is and how much the world is prepared to do for it.
1,200%. This is the rate at which the Wuhan virus infections have soared in Nepal in just a few weeks. The country, which has a population of just 30 million, was reporting around 100 cases a day last month. This month, the figure is nearing the 10,000 mark. On the 1st of May, Nepal reported more than 5,000 new cases. The figure increased to 7,000 on May 4th, 8,000 on May 6th, and 9,000 on the 11th of May. The country is reporting 20 cases per 100,000 people a day. Nepal is on the verge of a crisis that is as devastating as India, if not worse. The Prime Minister of Nepal has appealed for help. In an opinion piece published by The Guardian, Palki Sharma said, and I quote, "As I write this, my country is battling a new and brutal wave of the COVID-19 pandemic. The rise in the number of infections poses a serious challenge to our brave doctors, nurses, citizen volunteers, and the entire healthcare system. I have, therefore, appealed to the international community to help us with vaccines, diagnostic tools, oxygen kits, critical care medicines and equipment to support our efforts to save lives." Unquote. This appeal is rooted in reality. Nepal is not ready for a second wave. The country's fragile healthcare system is already under immense pressure. According to the Oli government's COVID-19 response plan, Nepal has just 1,595 intensive care beds, 480 ventilators for 30 million people. There's also a shortage of doctors, with just 0.7 physicians per 100,000 people, according to World Bank data. As of May 8th, there were hospital bed shortages in 22 of the country's 77 districts. The vaccination rate is also abysmally low. As of last month, only 7.2% of the population had received the first dose. Nepal's health ministry has conceded that it is losing control of the situation. Critics blame the government for peddling unverified cures. Last month, the Prime Minister said the virus could be treated by gargling with guava and mango leaves. Earlier, he had claimed that Nepalis had a very strong immunity because they consume a lot of spices. With the wrong messaging from the top, people violated social distancing norms. Many travelled to India to take part in the Kumbh Mela. This included Nepal's former king Gyanendra Shah and Queen Komal Shah, who tested positive for the virus. Today, such is the crisis that even climbers at the Everest Base Camp are testing positive. The situation is indeed alarming. China has already sensed an opportunity. Chinese planes have been flying to Kathmandu with medical assistance as the Chinese media pushes its propaganda with headlines like these. COVID-19 epidemic shows who Nepal's good neighbor is. Bureau Report, WION World is One.
WION is now available in your country. Download the app now and get all the news on the move.